everybody, it's Dr. Nicole Lindsey.
And I'm Dr. Bryan Gennett.
And we're at Back in Balance. Today we want to make some more sense of sciatica. This is part 2, the 4 most common causes of sciatica we want to talk about today. You know, knowing the cause of a problem is half the battle. And here in this office, we really pride ourselves on that, trying to help you figure out how you got there in the first place. And when it comes to sciatica, this is really, really important because there are various causes to the problem. And today we're going to talk about 4 of them.
One of the biggest problems that we see in our current state of healthcare is that we just play whack-a-mole with the problem, right? One problem pops up, we try and run over and hit that problem real fast, and then another problem pops up, then that problem goes away, and we're just kind of chasing our tails going around and around. You can't adequately have a solution or fix a problem until you know what causes it.
Yeah, exactly. And here's the thing, you can craft and create a really solid care plan and plan for prevention if you know what actually caused the problem to begin with. So that is clearly what we want to help you do, is not only just fix the problem, get rid of the pain. We learned in part 1 of this series that sciatica is a problem where pain is felt in the lower back, the buttock, and can go down into one leg, both legs, and even into the feet. So we want to help you figure out what actually caused the problem. So let's talk about that. So problem number 1 can be caused by
a herniated disc, and that's probably the most common cause of this problem. A herniated disc is when part of the actual disc material itself either prolapses or protrudes out and puts pressure on that sciatic nerve that runs down through these last couple vertebrae and then down the back of the leg.
Your vertebrae have cushions in between them at every level.
This guy's back's broken.
Except the top level there between C1, occiput and C1. But every level has a cushion. And this cushion is your disc. It's designed to absorb shock. It also enables you to flex and bend and move around. Now, the very center of that disc is what's called the Nucleus Propulsis, and it's a very gelatinous material. Now, from trauma, whether it's a big insult, car wreck, a fall, or repetitive motion, doing the same thing over and over again, bending, twisting, lifting heavy objects, that nucleus propulsus can actually tear through and rip the cartilage of the disc, the outer layer, and that is actually what hits that sciatic nerve and can cause the symptoms of sciatica.
The other thing that can be really painful is that we're tearing cartilage, right? I mean, anytime we tear cartilage, like if you rip like your ear, that's cartilage too. You rip cartilage in your knee, that's very, very painful. And this cartilage is very, very strong and dense. And when it tears, it hurts. You can feel it. Yes.
The second cause, most common cause of sciatica, is spinal stenosis. Now, your vertebrae are shaped like blocks. They look like squares stacked on top of each other. And in a normal healthy spine, you won't see any spurring of the bones. Now, as we age, if we have unhealthy posture, if we have repetitive activities in our daily life, if we haven't taken care of our spine,
lots of trauma, car accidents, things like that,
the bones can spur and grow in different directions. And some of these spurs can actually grow inward, and it narrows that central canal, which is where your spinal cord runs down the center of that. This is what spinal stenosis is. It's a narrowing of that canal, and what can happen is those spurs can actually hit some of the nerve roots and hit that sciatic nerve and cause the symptoms.
Not only can we have that narrowing inside the spinal canal itself, but we can have the narrowing where the spinal nerves themselves come out. It can be from boning, like Dr. Nicole was talking about, these bone spurs, or it can have just an overgrowth of or a hypertrophy of the muscles and ligaments, that the muscles and ligaments just get too big for the area.
Yeah, for sure. So the third most common cause of sciatica is what's called spondylolisthesis. That's one for you for a spelling bee. Spondylolisthesis is a forward slippage of the bone in your spine compared to the one below it. And when this happens,
when they stack up on top of each other, one ends up slipping forward.
When that happens, the bone can actually compress some of the nerve roots, hitting the sciatic nerve and causing sciatica.
That one hurts too. That can be from degeneration, old age, trauma, car accidents, injuries, or sports injuries. We see this often in young athletes.
The fourth common cause of sciatica is what's called Piriformis Syndrome. Your piriformis muscle is a muscle that actually attaches your lower spine to your femur, or one of the bones in your upper thigh.
Like that.
Goes diagonal. Now, what runs through that piriformis muscle, and of course you learned in part 1 last week that there are variations of this. So what can happen with the piriformis muscle, the sciatic nerve runs through the center of that piriformis muscle, and when that piriformis muscle contracts, it can squeeze that sciatic nerve, giving you the symptoms of sciatica.
Mm-hmm. And this is all these 4 different common causes are much different very different from each other, and they're going to very much change our treatment plan and the course of care that we're going to recommend for you based on what's going on. Some of these are very chronic, very long-standing problems. Some of these are very short, acute time frames and windows of problem. So we address them in a very different manner.
Yes, exactly. And also, there's risk factors that determine whether you are at risk of developing sciatica. And some of those are, and it's important to know that, are going to be certain careers or activities that you're putting your body in. For example, if you work in a warehouse and you have to lift heavy objects over and over again, a lot of bending, lifting, twisting at the same time really puts you at risk of developing sciatica.
Yeah. Really the thing that you need to know is that no one is safe from this. You can do it while having a very physical job, or you can just be in a very sedentary type position. This chronic position where instead of having a good curve in the spine, you're sitting and that's straightening out, putting lots and lots of pressure on the disc space, forcing that gelatinous material that Dr. Nicole was talking about out backwards.
Yeah. Another category that has high risk of developing sciatica is going to be weightlifters, especially weightlifters with improper form.
Totally.
If I had $1 for every time I heard a patient say to me, this all started when I was doing a deadlift in the gym and I felt and heard a pop, I'd be a very wealthy individual, because it happens a lot if you have bad form.
I think that the key word there is improper form. As humans, we're meant to deadlift and squat and run. We're just not meant to do it poorly.
Exactly. So that is our information for you today on making sense of sciatica, the 4 most common causes. And as we said earlier in the video, knowing the cause is the key. And that goes for anything, no matter what you're dealing with. And that's why it's really important to have a real thorough evaluation and x-rays and an assessment, so that your healthcare provider can figure out exactly what's going on, find the cause, and help you fix it and prevent it from coming back in the future.
The prevention is so important. An ounce of prevention is worth a pound of cure. You know what I mean?
Yes,
and
it is.
If we can stop you from having that pain in the future, that's worth a lifetime of happiness.
Absolutely.
I don't know.
Absolutely. Well, thanks for watching.
Thank you.